Sounds good. Are we ready, technician?
Yes, sir. Please go ahead.
Thank you, Dan. Good morning, going into afternoon. My name is Steve Hungersmark. I'm a member of the Innovation Advisory Team. Today, I'm going to be monitoring our time and the chat. Presentation will run from about now 11:35 to about 12:10, 12:15, and then we'll have 10 to 15 minutes for questions, and then a little bit of transition time to the next one at 12:30. This session will be recorded for future use should you want it. And the session is a lunch and learn roundtable entitled "Can You Hear Me? Understanding Cultural Competence and Deaf Culture in the Health Professions." And I'm pleased to introduce to you Professor David Bright from the College of Pharmacy. Thank you, David.
Good morning, and thank you all for being here. I'm very excited about this topic, and particularly for this topic here in this setting with this idea incubator approach, because as we'll talk about, I'm certainly not the expert in this. I'm learning, and I'm hoping that there's other people that want to learn together as we continue this on through at Ferris over the next few years here. So where I'd like to start is, again, with this goal of this incubator level roundtable discussion. And I want to start that off with some background of this American Sign Language for the pharmacy professional, and then also moving into next steps where we went for version 2.0, and then hopefully that kind of generates further discussion there. I do want to note that, and I'll back up just a minute here, Nicole Bailey is with us as well, who is a P4 student who was very instrumental in this project, and I'll talk more about that in a minute as well. So I do want to encourage, as those questions come up, if there's questions focused towards student leaders or anything as well, like I'd like to kind of spur all of that discussion in terms of how we can grow and do more and do better. So disclaimers and kind of foundations to kick off here. Again, this is just early progress, some lessons learned and kind of first iterations of what we've been doing here in the college and beyond. I don't want any of this to be taken as expert opinion, because we're certainly not experts. We're hoping to learn from others that are doing this as well. And one of the things that we've found is there have been some great resources and friends of Ferris that have come alongside of us to help be those experts. The word cultural competence is in the title, and in talking about that for a minute, there's a good friend of mine who I've been learning a lot from, particularly over the past year when it comes to cultural competence. And one of the concepts that she's been sharing with me is that cultural competence is a journey, not a destination, that you do not become culturally competent. And so I've been trying to emphasize that as well. I really like that concept, and that we're all growing, and this is one more area of growth. And I certainly don't mean to think that we're going to cover a ton of ground in that today, but hopefully this is helpful in moving towards that with the deaf and hard of hearing population and culture. Very much looking for growth and input as we are moving forward with this. So I know it's customary to save questions towards the end, but please throw things in the chat box as we go, or unmute and throw questions out. We definitely want that input. And finally, because I want to make sure that I have a chance to say this before we get all the way to the end of the presentation, the Diversity Inclusion Office has provided funding for 2 rounds of this work. And so I very much want to thank them. Same with the College of Pharmacy has provided funding as well. So David Pilgrim, Patty Tarrant, Franklin Hughes, really appreciate your support of this work and our students and health profession students here at the university. So backing up to the problem and kind of what we saw in the curriculum. So I often refer to myself as a drugstore pharmacist that wandered into academia a little more than 10 years ago. One of the things that I love about drugstore practice is that I had to be on my toes all the time to make sure that I'm communicating effectively with patients in the pharmacy. that I'm communicating how to make sure meds are taken safely and effectively, which meds, how to take them, that there's a lot that goes into that communication. And I quickly realized that I can't just tell everybody, yeah, you take that one in the morning daily. But the different people respond differently to communication. You have to have a lot of like there's a lot of finesse that goes into that. And so I became passionate about that. And in that communication, I found that I was also passionate about teaching students about that. And that's kind of what brought me into academia, was teaching students. And eventually, I came across a job posting that showed that Ferris was looking for someone to teach a clinical communication course. And that got me really excited. And so 7 years ago, I moved to Michigan, and one of the courses that I began teaching was this clinical communication course, which is probably, it has since been absorbed into other coursework in the college. It's a more of a legacy course, but it was one of the favorite ones that I've ever had the privilege to teach in. And maybe the, I don't know, third year of teaching in that, there was a student that came up to me one day after class, and this is Nicole Bailey, who again is here, so she can probably tell this story better than I can. But she came to my office one day after class as a P1 student, first year in the program, and she said, so when are we going to learn how to communicate with deaf and hard of hearing patients? And I was kind of struck because I was excited about this course and passionate about this topic, and I don't think that we do. On the professional side, I obviously see problem in that that's a subset of patients that need help. And if we're not equipping our students thoroughly to do that, then we found a gap that we need to address. So that's on the professional side. On the personal side, right about this time, my wife and I were on the journey of working with our youngest daughter, who was just diagnosed with cerebral palsy and a genetic condition that's foundational to that, which cerebral palsy, I'm sure many are aware that can take many different shapes and forms and have many different implications to it. For my daughter, we were learning that she was going to be unlikely to have verbal speech. And so we were just getting into some learning ourselves about American Sign Language and about ways of communicating without verbal speech. And so this kind of hit me simultaneously, both personally and professionally. And I thought, this is something we need to do something about. So I asked Nicole if she would be willing to help me figure this out and do something, because clearly she was passionate about the topic. And she also has some family in that space, and it was not long before I realized I would eat my words with her helping me. It turned into her leading this and running this, and me doing anything I can to help her. That she has been absolutely amazing in moving things forward in terms of helping our students communicate more effectively and learn those communication strategies. So where we went from there is we started brainstorming, and so started working with Nicole, who again, just a P1 student, just weeks into the pharmacy program, but already off to the races and quickly becoming the leader in this. We were introduced to Patty Whiting, who was a second-year student, who not only passionate about the topic and bringing students along to do better, but as a P1 student, she'd independently gone out and found a American Sign Language course because she wanted to personally be better at communicating with deaf and hard of hearing patients. So she had already gone and done this for herself, and now was passionate about doing that for others. Through that, she introduced us to the Grand Rapids Deaf and Hard of Hearing Services, who has been a friend of Ferris for quite some time and has helped lead ASL courses for Ferris students across campus. And so between Patty being an alumni of that course, Nicole having other life experiences, the two of them were able to jump in and work with Deaf and Hard of Hearing Services. We invited them up to campus. They met with us. They have been absolutely amazing. If you're ever in need of assistance in this space, I can't say enough good things about that organization. And they were very helpful and very receptive to talking through and building something out that could be pharmacy student specific. One of the things that Patty shared is that in a general ASL class, there's a lot of kind of basics and general words that you might need to know for just activities of daily living, like cooking or dance or things like that. And in doing that, that's probably less healthcare specific. And if we're going to drive something down to a very narrow focus, then we probably need to rearrange that curriculum a little bit. And so Nicole and Patty were incredibly helpful at working with deaf and hard of hearing services in putting together what could be a curriculum and course sequence for our pharmacy students. We also pretty quickly got in touch with faculty, Drs. Axford and Dr. Savati, and then from the administration side, also Dr. Larson. So Dr. Larson, as the Assistant Dean of Academics and Practice, brought that full curricular perspective in terms of helping us brainstorm where and how things might fit in the curriculum to make sure that this is not a gap. From the faculty standpoint, so Dr. Axford is our co-curriculum coordinator, where we thought about if this is going to be multiple course sequence and a bigger curriculum and things like that, maybe this is a great co-curricular experience for students to engage with. Dr. Savati is our interprofessional education coordinator, and she brought the perspective of this probably isn't just a pharmacy issue. This may impact other areas of campus, and there may be ways that our pharmacy students can learn with, from, and about other professions as we learn together about communicating with deaf and hard of hearing patients. So brought a lot of people together, and along the ways ran into a lot of people that had personal and professional stories and background of working with or family or friends that are deaf or hard of hearing, and seeing a lot of passion come out in this space, which was just really positive and powerful. As far as the content that was covered, certainly there's some basic American Sign Language that we wanted to cover, though one of the just foundational pieces in this program is that at the end of what turned into 4-course session, 4 days, 90 minutes per program, you're in no way going to become fluent in American Sign Language. You're in no way going to become an American Sign Language interpreter. In fact, at the end of this, I almost, like, one of the biggest things I took home is there's so much that I don't know that I thought I knew. And it helped me learn that I need to learn a lot more. But the basic sign language is really helpful for getting just some of those functional things down. I personally learned a ton from the deaf culture piece and working with interpreters piece. And those were two aspects that Nicole, Patty, Deaf and Hard of Hearing Services, everybody was very passionate about making sure we had in there. Because there's so many things that are just natural but wrong, if that makes sense. Like, for instance, in working with interpreters, it was, I tend to try to make eye contact with the person that I'm talking to. So I thought that if there's an interpreter sitting over here and someone I'm trying to talk with over here, that I'm supposed to talk to the interpreter this way, so that the interpreter can then talk with and sign with the person through sign language, only to learn that that's incredibly rude and disrespectful and not a good fit at all, that I need to be communicating with the person who's deaf or hard of hearing, and the interpreter can assist in that. Not only, even from a deaf culture and ASL standpoint, learning that I tend to think that it's mostly signs that communicates what you're trying to communicate, but learning that the things that I think of as nonverbals, that facial expression or gestures and body position and things like that, even where the sign is, communicates so much as well. So that square shoulders to the person you're trying to communicate with is really important. So again, we could go on like many tangents of nuggets learned and things like that, but I I wanted to say that simply to emphasize this is not just a American Sign Language course that was done, but a lot of background in deaf culture, working with interpreters and other aspects like that that helped to build this course of American Sign Language for the pharmacy professional. As far as logistics and how this happened, again, none of us were in a position where we were qualified or confident to do that teaching directly. But Deaf and Hard of Hearing Services jumped in to manage the course instruction needs. They had resources and books and curriculum and lots of experience in teaching classes like this. And so Deaf and Hard of Hearing Services made the trip up from Grand Rapids and led coursework in Big Rapids. Nicole Bailey and Jessica Berkey joined as tutoring session leads. One of the things that, I'm sure as educators we're all very familiar with is that not all students learn the same way. And so some students would go home with an American Sign Language book and would look at pictures and practice signing. Other students would go home and there were YouTube videos that were made available where you could see someone sign and they would practice that. Other students wanted to do this really hands-on in a tutoring session. And so Nicole and Jessica would work with students in this course to make sure that they had those extra practice opportunities. This was run in the spring semester. We began in 2019 as evening classes. The students, when we did the marketing for this, were told there was a $50 fee for their involvement. The support from pharmacy and the diversity office brought that cost down substantially. So after they committed and were willing to pay that much, the fees were brought much further down, which again, really appreciate the financial support for the students in doing that. It was really heartwarming to me too to see students that in the middle of spring semester or in the early spring semester when it's cold and you don't want to go outside, you want to go place, like they're paying money to come out in the evening and take on extra coursework on top of their already heavy course load. And it was just an incredibly positive and heartwarming thing for me to see our students step up and do that. So I can't say enough good about the students and faculty involved in this, DHHS, the student participants. This was just really positive experience. One of the other layers of this is we wanted to make sure that this was done in such a way that it could be replicated elsewhere. And so we quickly talked with Dr. Minji Sohn in the College of Pharmacy, who helped us to make sure that there were strong research methods and assessment practices in this to make sure that we could identify what were the gains, what were the learning, what were the lessons learned from our side of implementing something like this. And so that ended up turning into a publication in Currents of Pharmacy Teaching and Learning, where we're hopeful that now others may share in this work and replicate this elsewhere. Nicole, Patty, and Jessica, the three students involved, very appropriately are the first, second, and third authors of that project because, again, they ran this. I know that they're students, but I feel like I was in the student role learning from them the whole time. So they did fantastic work and were first, second, and third authors on this paper. There were even further presentations with the American Pharmacists Association meeting, the American Society of Health System Pharmacists meeting, and on the national stage, even from the Michigan Pharmacists Association, Nicole and I were able to go and present continuing education to practicing pharmacists on some of these same topics with Deaf and Hard of Hearing Services making the trip over to Detroit with us for that conference. So we've been trying to make sure that this is not just one thing that happened at Ferris one time, but that could also be shared and to make sure that students involved got that experience as well. The pre-post assessment that was done showed that students had increased confidence in working with deaf and hard of hearing patients, increased confidence in working with a translator interpreter, increased knowledge of key concepts for working with deaf and hard of hearing patients. Again, that became a publication, and so that was really positive as well to see the students have a chance to be involved in that part of it. That grew into year 2 of the work, where collaboration then with the Michigan College of Optometry was our next goal. We wanted to grow this in an interprofessional way, kind of going back to the suggestions that Lisa Salvati had for us in the early brainstorming, is how can we then engage other professions? So with that goal of interprofessional collaboration and expansion across campus, we went a couple doors down to the optometry school and tried for this goal of maximizing this learning with, from, and about each other's work. There were many similarities. For me personally, I'm one of like the very few that doesn't wear glasses or contacts, and I don't have a lot of background. The field of optometry was not something that was very familiar to me, but through other work and through this work, it felt like a really natural fit, because we are both professions that deal with a service and a product. We are both often, especially if I think about drugstore pharmacy, we're often in a isolated setting without having a lot of other healthcare professions around. And so there's so many similarities about how our roles function on a daily basis, that these kind of communication support resources really seemed like a good fit in running this course together. So Sarah Hinckley was super helpful in getting a lot of the logistics and marketing set up. We had Joe and Daniel then join us as well for the class. So I loved the faculty and student support out of the Michigan College of Optometry, and big thanks there as well. We also saw Brianna Bryant, Haley Strahl, who were in the initial class as students in the initial pharmacy program, stick around and want to participate in a second year as those extra study session tutors. And so thanks to those as well. Year 2 ended up going a little different than we expected, because this thing called COVID-19 happened. And so about halfway through the program, we had to pivot to Zoom. So pivoting to Zoom was kind of out of nowhere, and before we all knew what that really meant, we had to dive into that. So that even, I don't know, my daughters are very much right now into watching old Bob Ross reruns. And so I keep going back to that verbiage of like, one of the happy accidents of pivoting to Zoom over COVID is that it allowed us to teach things about signing on COVID and signing over Zoom and signing with devices. One of the stories that the instructor would talk about was in settings where there's not an interpreter handy, oftentimes there may be some kind of video interpreter where you're handed an iPad, and then the healthcare professional involved assumes that, okay, now everything's good and I can just talk and whatever. And she said that one of the foundational disconnects in that is when the healthcare professional handed her an iPad, she was holding the iPad with both hands. And when you're holding an iPad with both hands, you can't sign for the person on the iPad to see what you're trying to communicate. So we learned a lot about how all this was coming together in terms of communication through video-based communication. Things that I learned as well are that we have a lot of folks that tend to join Zoom calls and they're up here. And if they're trying to sign, you can't see their fingers. So we learned that you have to really back off. And then if you do that, like as a Caucasian individual, if I have a white or tan shirt, it's harder to see my hand. So we even learned about background and colors versus if I'm wearing a dark shirt, it's a lot easier to see signs that I'm doing. So we learned about even wardrobe and dark backgrounds or light backgrounds and things that you can do to make sure that when trying to communicate over Zoom or other tools like that, the digital communication with signing, how to make that happen as well. So we saw some of these difficulties and also some of these access pieces being taught with those tangible examples. So again, spring 2020 was quite different than we were maybe expecting, but we tended to roll with it and go with it, and it still worked in a different way. And it brought us, I think the other kind of quick tangent that I'll go down, it was a learning experience as well, was that there's a temptation, especially over Zoom, and again, as a quick plug for please keep putting your thoughts in the chat box, is to use the chat box to communicate. If you're really struggling with signing, there can be this temptation to try to use written English. But one of the deaf culture pieces that really struck me and has stuck with me is that there are many in the deaf community where English is not their first language, particularly written or clearly spoken English may not be their first language. It may be that there are deaf individuals that cannot read. And so if you're trying to use written English, that may not be effective communication with deaf patients, and trying to ignore signs and go only to that written text or written chat, that can have a disrespectful connotation in it there as well. So I think there's always this need to balance effective communication and accuracy, but with respecting the patient and making sure that and so we had a lot of conversation about those kind of issues too, which I think is really powerful for our students in healthcare. So 2021, we did not run the class again this spring. I feel like the constant line that I keep hearing is between budget and bandwidth, we couldn't fit it in. And I don't want that to be the end of this. Certainly we've lost some momentum, but we wanted to be here today to see if there's a way that we can stoke that fire a little bit and see if there's others that want to participate, other ways that we can continue this. I'm excited that for Nicole that she's graduating here in just a couple months, but I'm also sad because our leader on this is leaving the university. So I want to also see if there's others that are passionate here and are willing to continue this. So I will set up the next slide, which has some questions on it and topics that I would love to discuss further. As I'm bringing that up, I want to first pivot to Nicole to see if there's any other questions or thoughts or other suggestions for discussion that she wanted to throw out there. I wanted to just open to Nicole and to thank her once again for her continued engagement in this work here at Ferris.
Thank you, Dr. Bright. Can you hear me?
Yes.
It was a wonderful presentation. I think the only thing I wanted to comment on, when we communicate with deaf and hard of hearing patients, most people rely on lip reading. And these patients' population only catch about 30% of what you say when you with lip reading. And even with COVID, it's a bit harder to know who's talking with a mask. So in these times, I would suggest to try to point to yourself or step forward when you're talking to deaf and hard of hearing patients with masks on, especially in a medical setting.
No, that's a great point as well. I know that there are clear masks available as well, and the university has supported that. So if you have students that you're working with that may be deaf or hard of hearing, where that lip reading is helpful, there's certainly resources as well to make sure that the clear masks are available to help with that as well.
Mm-hmm.
Yeah, so with that, the three questions that I don't know that they need to go in any particular order, but like was mentioned earlier, I wanted to take a little more time than that obligatory 10 minutes of discussion. So we purposefully cut the content a little short so we could have some discussion. What experiences do you have with cultural competence training for deaf and or hard of hearing patients? What ideas or suggestions do you have for our next steps, and who else on campus may be interested in collaboration? I saw Stephen, you threw a note in the chat there about criminal justice, and I've been fascinated by that idea. So I'd love to hear your thoughts on that.
Thanks. Yes, that's obviously it's very important. Police officer or somebody working at a correctional facility, that they understand and have this type of training. And I think that there's in the state of Michigan, other states, I guess, there's a lot of mandated training, but this certainly isn't, it should be, but it isn't a part of the mandated training. And you can, just think about the ramifications of a police officer going out there, without this. So this is certainly something that we could provide. We have a police academy here, and for students in the criminal justice program going to probation or wherever.
I mean, one of the things that has crossed my mind repeatedly is with my daughter, if she's in a position where, she's pulled over or she's, somehow, I do worry as a father that some of the signing can look like you're reaching for something or doing something that could be really suspicious and could be concerning. So I can see how even just some general basics there would be really helpful.
This is actually really common. There's been quite a couple stories of deaf patients being shot, or deaf people, because they're trying to reach sometimes a card saying that they're deaf, or try to communicate with their hands, and it has led to unfortunate accidents. So I think it's a great idea to get them involved.
Sure, it does. And said it's something that we should be thinking about and we should take seriously. I would imagine that this holds true for anybody that has any sort of interaction with the public.
Yeah, I'm curious if there are other programs out there on campus that have tried anything like this, or where it may be a fit, or I know I still feel like I'm new to Ferris, even though I've been here 7 years, but I know that there's a lot of nooks and crannies out there in Ferris that I'm not aware of. So I'd love any other brainstorming and other groups, programs where there may be some kind of intersection with American Sign Language training, deaf cultural competence, those kind of things.
So in the chat, we have somebody that says that maybe in social work, it could be done. So there obviously are other programs out there, David, where this could be used, and people are open for it.
Yeah, and I'm taking notes as well for social work, criminal justice. I think those make very good sense.
David, related to online learning, I know I've had, there's been an emphasis now with EIO to really push readers and such. And that's something that I never thought of before. Any push in that direction as far as teaching goes online, and what could be added there, what could be emphasized online?
Yeah, one thing that I've been increasingly tuned into is some of the captioning support through Canvas and those things as well. And as we've said, not everyone that communicates with ASL, I mean, English may not be their first language, and so there may still be some struggles there with captioning, but between the captioning and transcribing, options that Canvas offers, and that there are Zoom plugins that can do that real time, and other devices like that that can be really helpful.
Right. Dan made a good point here on chat that Zoom has just rolled out a device, which I didn't know till today, auto transcription service. That's something I've noticed also with ebooks. I recently started with ebooks, and the fact that they have readers for them is awesome now.
David, this is Dan at eLearning. Like I said, Zoom did roll that out. As far as we know, it's the individual has to turn it on. It's not something that the host turns on for everybody. But more broadly, we work with disability services a lot on assistive technologies, and I'd be curious, across the university, how the applications of this kind of stuff for any faculty member teaching online or hybrid courses in particular.
Yeah, at a prior institution, I taught a class where I had a deaf student and an ASL interpreter at that time live, and so I can, the technology available today is leaps and bounds above what was even available just 10 years ago. So I think there's a lot of opportunity there. I'm really fascinated by the live transcribing and what can be done there, or the live captioning, I'm sorry, what can be done there. And I have a feeling too that a lot of these resources that we can put together, even for recording lectures, for captioning, for transcribing, that we think of that oftentimes in a accommodation standpoint, but there's probably a lot of value for students at large as well to have access to transcripts and things like that of lecture content, even just to be able to find where in the lecture a certain concept was, so you could fast forward quickly and re-watch that part or something if there was something that was missed.
I attended a conference 2 weeks ago where they did use that live captioning, product or whatever you want to call it. And it was super helpful because, even, I'm not deaf of hard of hearing, so it was not really for that reason that I was using it, but there was a period of time where someone came to the door and my dog was barking so loud I couldn't hear what the person was saying, but I could read at the bottom of the screen what was being said. So I still was able to kind of keep up with the conversation. And having access to that whole transcript, I agree. I could see that being like a really nice thing for students who are maybe attending class through Zoom, and then they just want to get the transcript of what the instructor said after the fact to be able to transition it into text notes. And it was super easy to use, turn on and off. And you could access either like the caption rolling at the bottom, like standard kind of closed captioning, or view the entire transcript in what essentially looked like the chat window. And it was just rolling, adding text the whole time.
That's good to know too, because one of the things that I learned through ASL class is if you back up and you're signing, a lot of times that's on the lower half of the screen, which would overlap with the automatic caption. So if that can be done in a kind of pop-up window over here, that can be helpful as well.
I didn't play around with it a ton to see if like you could move where the words show up on your screen or anything like that, but I did see that you could at least access the full transcript that you could then kind of scroll back through live and see what was being said in, like I said, that sort of side chat box. I see somebody added it.
Oh, does that show up for everyone?
Yes.
Oh, okay. We're kind of, okay, I've turned it off again, I think. we're kind of diverging from the main theme here, but that's good to know. We're learning things. And to your point, Jenny, if you're using the strip across the bottom, the closed captioning looking version, you can actually click and drag that wherever you want on the screen.
Well, David, this is all really good. And I think it could actually save a life. It would be interesting if you could turn this into a 1-credit course or something, or a 3-credit course, I guess, for that matter, where different students could plug in, or it could be required for students. That might be a route for you. I don't know. But I'm sure everybody here can see the usefulness of this and the absolute necessity, actually, of this. Not usefulness, but necessity.
No, I think that's maybe another thing we could talk about for a minute. I like that you bring that up in terms of turning this into a curricular instead of a co-curricular endeavor. One of the ideas that I believe may have been Dr. Larson's idea was to see if there are other aspects, because maybe 2 or 3 semester hours on ASL and deaf and hard of hearing patient communication may not be the key, but maybe there's a way to blend that in with Spanish language or other communication barriers that can be common, and almost a course in overcoming communication barriers in general that may then have broad applicability in health care, criminal justice, social work. I think that could be even more broad. So I guess from that angle, what other communication barriers might be useful in covering in a class like that?
Well, certainly mental health is a crisis. Jenny just brought that up. So excellent stuff there. I mean, it's pretty universal. So. Anybody else have anything? All right. Well, your information is there. It's been recorded. Feel free to reach across to me, David. And great job. This is really neat that you're doing this. And hopefully it continues to go forward with it. So thanks again. Thank you, everybody, for attending. And excellent job.
Thank you all very much for your time today. And thanks to Nicole for carving out some time on her clinicals today to join us, and for being the lead for the last 4 years in all this work. So thank you very much.